Well, looks like we're gonna have a preview. Not quite as exciting as a movie trailer, but same idea. Tantalizing us with what's to come.
Yeah, sort of. This page will give you a quick preview of the child's phonological system, but you have to be disciplined and not spend much time here. Spend a maximum of 5 to 10 minutes skimming the data to get an impression of the phonology and see which parts of the scan will be most relevant for that child.
So what impressions will I be looking for in the client's data? What sections are there on this sheet?
We'll start with word structure, then vowels, consonants, variability and sequences, and the final box asks for other information about the client.
And how will I fill out this page?
Begin with word structure. Look at the client data and see whether syllables are missing from words, which are deletions, or added to words, which is epenthesis. If there are none or only a few of these, check off the appropriate boxes in the clear strength column. Otherwise, it will be something to analyze later. Let's look at Craig's data. What do you see?
He doesn't seem to be adding things, so green for the epenthesis makes sense. But there do appear to be some consonant deletions, so I guess we need to analyze that later. I don't notice syllables missing though. Even sunglasses has 3 syllables.
Right. We see the right-hand word structure box is highlighted red for further analysis. Remember that color coding is suggested. However, feel free to add your own personal color coding or notations. Some people may like to keep a tally of the number of productions or errors in addition to the color coding. Next is the vowels section, where we are looking to see whether the client's vowels match those in the adult target. If the vowels seem to be on target for the most part, check the clear strengths column. However, if their productions are inconsistent or absent compared to the adult target, check the needs analysis cell to indicate that the vowels need to be analyzed in further detail on page 7. What do you notice about Craig's data?
Well, the vowels do seem to be showing some inconsistencies, so that is why the scan shows we will need to analyze those later. And they're in yellow because they're inconsistent. So we can see they're inconsistent. We have 2 examples of vowel mismatch, where bib goes to B and tub goes to tap. Or we have 2 examples of vowel matches as well. So we have B goes to B, which is the same, and piggy goes to bitty.
Again, remember that deciding whether something is a strength versus inconsistent may depend on the number of targets elicited in your data. It is up to your personal judgment. However, it is important to try to stay as consistent as possible throughout the scan analysis. Next is the consonant section, which is subdivided into manner, place, and laryngeal/voicing changes. The manner is the way the air flows through the oral or nasal cavity to make a speech sound. For example, the following are different manners: stops, fricatives, nasals, and so on. You can go to page 6 to learn more about this.
Okay, so would S going to T be considered a manner substitution?
Correct. Next, the place is where the speech sound is made. For example, labial sounds are produced with the lips, coronal, which uses the tongue tip and blade, and dorsal sounds involving the velar area. There are different places where sounds can be produced.
Okay, so an example of a place substitution would be K going to T.
That's correct. Now, the laryngeal or voicing quality of the speech sound concerns the vocal folds. Voiceless, voiced, and aspirated are different types of laryngeal qualities.
Okay, so D going to T or glottal stop would be considered a laryngeal substitution, right?
You got it. Now, if consonants are found to be inconsistent or absent, then filling out page 4 will give you a more in-depth analysis of their consonant inventory. Let's look at Craig's consonants. The scan sheet seems to indicate a big need to look at manner and place, but voicing is inconsistent. Can you see some examples of manner and place substitutions in his data?
Well, for manner, there's F going to B in the word fishing. And in the middle of the word finger, we have Y for the ng. And what about place? Well, we have T for K and glottal stop for a bunch of things. Yes, lots to look at later in his consonants. Laryngeal was classified as inconsistent, right? There is sometimes a match for voicing and sometimes not. So you can see this when comparing the word page and piggy, for example.
The next section looks at variability and sequences. If the client's productions are generally not variable, then check the box under Clear Strengths. If the client produces different productions of the same word or speech sound, check the appropriate box in the Needs Analysis box. Our small data set doesn't have the same word more than once, so we can't comment on same word. But there does look like some inconsistency on the same sound, as you already noted with the aspirated P of page and piggy. Assimilations can result in inconsistency for various targets. Remember what assimilation is?
It's when features of one sound affect features of another sound in a word. For example, dog pronounced as gog.
Exactly. I see a yellow for assimilations, meaning inconsistent use of assimilation. Where does this happen in Craig's data? Let's take a look.
Well, we can see that in fishing, actually, BB.
Right. If consonants or vowels often move to other places in the word, check the corresponding box in the Needs Analysis column. If there are boxes checked in the Needs Analysis column, then filling out page 5 will give you a more in-depth analysis of their speech sound variability and sequencing. The final section collects other information about the client. This information may be based off of informal observation, parental report, or formal testing. This may be useful for treatment goals and activities. Well, what do we see about Craig? He seems to be doing well overall, except with some issues in language production and pre-literacy. But then again, he is just 3 years and 1 month old. Based on this, you may decide to incorporate language therapy, or that home practice may be appropriate. But there are many ways in which you can use this information in order to support your goals, as we will see when we get to the end of this tutorial.
So what's next? Now that you have completed this page, you can look at the Needs Analysis column to see which parts of the phonology you might want to take a closer look at. In Craig's case, the overview suggests we do a more in-depth analysis on pages 3, 4, 5, 6, and 7. However, it is ultimately up to you and time constraints which pages you decide to analyze further. This will allow us to determine specific goals and goal sequences.